Hello, my name is Roger Baker. I'm Professor of Clinical Psychology at Bournemouth University. Our research team has been developing the emotional processing scale over the last 15 years, and it was published in July 2015 by Hogver, the psychological test publishing company based in Oxford. It's a European company. Now, what I want to do in this video is really to demonstrate how the emotional processing scale might be used in therapy. I use a variety of therapies, cognitive, behavioural and emotional, but the emotional dimension seems to be missing from much therapy and assessment. So this is fills a useful gap. The example I want to give you is of a panic patient who came to see me. She had been in a relationship which was very troubled and trapped for several years. That's where her panic started. The relationship broke up, but the panics continued. In our first assessment session, I gave her the emotional processing scale to fill in, which is based on just emotional events in the last week and what happened in the last week. It's 25 items, 5 subscales. She filled this in, and this is a mock-up of her scores to show you here. The scale is filled in, there's 25 items, and then there's a pull-out sheet for the test administrator, and we're looking at the score sheet here. There are, as I said, 5 dimensions the scale measures: suppression of emotions, the signs of unprocessed emotion, things like recurrent emotions, intrusive emotions, signs that something has not yet been processed properly, how much control the person feels they have over their emotional life, how much they avoid emotional situations, avoidance, and finally emotional experience, how good an understanding of their emotional life they have. All these can be added together for a total emotional processing score. So that on this scale, for instance, the first item, I smothered my feelings, she's agreed with that, so we take it across the score to the first one, suppression, and we will continue to move over the scores for unwanted thoughts. 7. Okay, that's a mock-up. This is the actual form that the patient filled in. Having rated all the subscales and calculated a mean, we take the mean over to the profile chart. Now this is the bit that's really the most useful, I think, in therapy, and I use it a great deal now. This is a percentile chart for healthy UK adults. It shows the average scores between the 25th and the 75th percentile, and then going beyond the 75th percentile up to the 95th. So scores here are very problematic. If we look at this particular patient, her total score is very high in the 90th to 95th percentile, showing problems in her emotional life. The emotional experience score is particularly high, suggesting she does not greatly understand her emotional life and possibly suggesting an educational component in the therapy. Interestingly, avoidance is totally normal, so she is not avoiding emotional situations, although she is suppressing emotional feelings to a great extent. This is fairly high, 75th percentile, the signs of unprocessed emotion, suggesting there is still material to be dealt with that's problematic. And actually this turned out to be the relationship she broke up with. There was still issues that need quite a lot of resolving with her. So this was a very useful starter for the emotional aspects of therapy. I showed her this as a way of feedback, and she found this quite helpful, and it brought home particularly the point that she was suppressing emotional feelings, which she hadn't appreciated the degree to which she was doing it. The third element of this, of course, is that you can give it later in therapy to see whether people are improving or not. So I'm finding that this is very helpful in all sorts of aspects of therapy. So thank you for listening today.